Hello, Dr. Haussmann with AR Health, back to talk about questions that have been submitted by our followers regarding sexually transmitted illnesses and sexual health. I have some questions here in our little cup. Let me reach in here and see what's on your mind. What is emergency contraception? Okay, emergency contraception is a usually pill that is taken to protect you from becoming pregnant. It is used after a sexual encounter that perhaps was not expected or intended, and when there was not proper contraception in place before that. There are a few different types, actually. There are both insertable contraception, something called an IUD that can be put in by a doctor after you've had a sexual exposure where you're concerned about pregnancy, and then there are pills that can be taken. And within the pills, there are really two different types of pills that are used as well. One of the pills is prescribed by a doctor, and the other pills are available over the counter. There are things over the counter like Plan B and My Way, for instance, which you don't need a prescription for and you can take them. Those are generally used for people who have had a sexual encounter within generally a 3-day period, 72 hours, and they're very effective, but they're not as effective as the prescription ones. The prescription ones will allow you to have as long as 5 days since the sexual encounter, and they're probably a better choice for people who are what we might consider higher risk for pregnancy. Depending on where someone might be in their cycle, they may be more likely to get pregnant at certain times of their cycle. And actually some of our, plus-sized individuals actually do better with the prescription medicine. The over-the-counter one will sometimes not fully prevent pregnancy in those individuals. It's something that if you have questions about, you should definitely get in touch with your doctor. You can get back in touch with us if you have further questions that I can answer for you. But emergency contraception is a valuable tool for people who are at risk for becoming pregnant when they don't want to, and they can use that to help reduce that chance. So get back to us if you have any questions.